Good morning. It's my pleasure to be here today as one of the anchor institutions in Pottstown. Pottstown Hospital recently went through a change of ownership back in October of this past year, and we went from a national or owned by a national company to being acquired by a more regional presence. Reading Hospital had purchased 5 hospitals in the southeastern Pennsylvania market, and we became part of what's now called Tower Health. So we've been going through that transition for the past 6-7 months, and I'm happy to report it's going very smoothly, and that what is nice is having a regional partner is they recognize some of the challenges that we're dealing with at the local level. So one of the first things that Tower recognized was our building had some age on it. It was built in 1973, and they've reinvested into the hospital well, in this past 8 months, already $4 million in infrastructure improvements, with another $8 million to be invested in fiscal year 19, starting July 1. So I'd start off with a little bit about who we are. So we are an acute care hospital, but we offer a very robust list of service lines. So if you can look at the screen, you can see that critical care, monitored beds with telemetry, obviously medical surge units, orthopedics, maternity care, our cancer center, both for medical oncology and radiation oncology. We have a state-of-the-art linear accelerator as well as a CyberKnife at the Pottstown facility, behavioral health and senior behavioral health, a very busy emergency department, and complete surgical services. Our primary service area is that space that you see in that greenish color. Basically, we're looking at Pottstown, Pottsgrove, Royersford, going up to Boyertown, but our secondary service area stretches into Berks County with Douglasville and Birdsboro, and all the way down to Phoenixville, where we do have a sister hospital. Who we are. As I mentioned, we are the largest employer in Pottstown. We have 326 physicians. That number continues to grow on our active medical staff as we recruit in. 44 different medical specialties. That number will change by the summer as we add 3 additional service lines once the contracts are signed. 1,100 employees, and a very robust volunteer program with over 140 volunteers. I put this slide up here because one of the things that our leadership team is focused on, healthcare has changed quite a bit, and it continues to change. And one of the focal points that the leadership team at Pottstown has been working on for the past 2.5 years is obviously the quality and safety of the care that we provide, but now patients expect more. And it really needs to focus not just on the quality, which is first and utmost importance, but also the patient experience. So the team at Pottstown has been focusing on what happens when the patients come into our hospital to the time that they leave, and then the follow-up care afterwards. So the focus has been on the patient experience. And these are just some of the comments from our local paper at the Mercury, where people have wrote in about their experience and just how positive it is. And that will continue to be a focal point under Tower Health. Our Board of Trustees, I put this up there because I think it represents a little bit of the flavor of the leadership of the hospital. There are 5 physicians on the board, but there's 6 community leaders. That's relatively new in the past 2 years. It was very physician-centric as a board, but the hospital recognized that to be part of the community, we have to be engaged in the community and also hear from the community. So we went through several different aspects of community leaders to look at who can really give the most input as to what the community would like to have happen at the hospital. So there's 6 community leaders, and then there's 2 hospital administrators that serve on the board of directors. What we do, again, this is similar to the service line slide, but I did want to point out that with our emergency services, where we're located along the 422 corridor and right off the Arm & Hammer exit, we get a lot of business into our emergency department from the Tri-County area. We're not just pulling from Montgomery County, we're also pulling from Berks and Chester. Pottstown Hospital has the 2nd busiest emergency department in Montgomery County. The only one that's busier is Abington Hospital. and that's because it's a Trauma 1 center. We're not a trauma center currently. We do about 43,000 visits through our emergency department. It's a busy place, so that's one of our shining stars. We talked about surgery, and we've recently added bariatric surgery, and more complex hernia care is going to be occurring starting this summer. Orthopedics, endoscopy, cancer center, wound care, maternity, and again, behavioral health. I like to call this our brag wall. Why should patients feel confident coming to our hospital or the community? So starting off with orthopedics. So we do have the Joint Commission certification for Orthopedic Joint Replacement Center for both hip and knee. Again, one of our shining stars is our cancer center. This is a brag point for us because unfortunately I think it's one of our best kept secrets. So we are accredited by the American College of Surgeons, the Commission on Cancer. But what makes us unique is we are the recipient of the Outstanding Achievement Award 5 consecutive surveys. So going back to 2005, all the way through our latest in 2017, that distinction is shared by only 4 other cancer centers in the United States. We're the only one in Pennsylvania. So right here in Pottstown, you get some of the best cancer care, not just in the state, but in the country. More certifications, Joint Commission over Primary Stroke Center. This is an accreditation that we went for, again, because of the amount of traffic that we have coming off of 422, and stroke and heart attacks are 2 of the areas that time is of the essence. So by being a primary stroke center, EMS teams and ambulances can come to us first, and then if we cannot treat the patient, we can stabilize them to transfer. So that was incredibly important for us to do that, because otherwise our patients would have to travel up to Reading, up to Lehigh, or back to Abington. So when you're dealing with heart attack and strokes, we call time is tissue. So by being able to serve our patients, we could give better outcomes. We're also American Heart Association Get With The Guidelines Gold Plus Target Honor Roll Achievement Award for 2017. We talked about the importance of cardiac care. So through the American College of Cardiology, accredited with both Chest Pain Center as well as Heart Failure Center. And then we're starting to spread our footprint, and that's another thing that Tower Health will focus on as our new owners is spreading the access to care to our community. So currently we have outpatient facilities in Boyertown, on Medical Drive, which is in Pottsgrove, but right next to the hospital, and down off Route 100 at our Careplex location. We do have sites slotted throughout the service area that I showed on the map earlier to, again, provide increased access to care. Looking at some of our statistics, there is a move throughout healthcare to do more on the outpatient side, but we've actually, at Pottstown Hospital, seen a different move. Our admissions are increasing, and a lot of that has to do with not to go into too much of the detail, but as healthcare plans, insurance plans change, patients are tending to wait to get care because of the high deductible plans. Sometimes they wait for their tax returns to come back and before they do anything elective, and what happens is the condition they have progresses, and when we get them at a sicker point. So we've actually seen an increase in our admissions, so just under 9,000 for 2017. I mentioned earlier the emergency department does just under 43,000 visits or 42,000 visits in 2017. We're doing about 9,500 surgeries and 428 births. We have seen a decline in the number of births that are happening at our hospital, and that's something that we are addressing through our new ownership to make it a better experience for new moms, so they'll choose our facility. And that's a quick overview, and I'm happy to answer any questions you might have about the hospital. Community College, it's one of the things I've been working with Dave DiMatteo on is trying to bring some of the coursework to the West Campus. Most of the allied health courses are done at the Bluebell campus, and we're trying to work out opportunities that the West Campus can offer some of those classes, so we can offer rotations, internships, and clerkships for patients students who may be interested in that field. With the high school, we've been working, and I'm sorry, I don't remember the term, it's not VOTEC anymore, but we've been working with Stephen Rodriguez's team there with having some of their VOTEC students, we go and we do some classes with their allied health and health careers. Our staff will go and lecture, and we're trying to work out the fact that they can come in and rotate with us. It was announced last week, or the week before last, I'm sorry, that Drexel Medical School is partnering with Tower Health to build a new branch medical school, which it's not a satellite campus, it's a full service medical school with medical students, all 4 years, residencies, fellowships, based in the Reading area, Wyomissing, and we expect the first class to be in 2021. Yes, we will be benefactors of that as additional training site, as well as being able to bring in residents and med students for training. So we're very excited about that. One of the challenges that we've been working with is nursing. There is a shortage of nurses, especially for general acute care. And as we've been going through the recruitment process, we've had to pull from outside our normal service areas. So we do have nurses coming in from as far away as Philadelphia, some coming down from Reading. So they do live outside the area, but I don't know the exact statistics, but I'd say probably 25 to 30% live in our primary service area. But no, we haven't seen housing as a problem. We don't have a shortage of nurses. The United States has a shortage of nurses. It's a field where they're aging out. They're not recruiting as many in. There's fewer nursing schools. They've moved from a LPN, which is a licensed practical nurse, to a full bachelor's degree to be eligible to work in most hospitals. So it's just a challenge that we are working on throughout, not just our health system, through the whole country. There's no indication that UPMC is going to buy Pottstown Hospital. We do have a joint venture on an insurance product. Tower Health does. It's a 50% ownership with the health product, not with UPMC itself. So there's no discussion currently that I'm aware of any ownership model for UPMC and Tower Health or Pottstown Hospital. We support the community in many different ways, but from the tax base, I cannot comment on that, as that's working through the process, through the regulatory and legal process of switching from a for-profit to a not-for-profit. Until that's done, I cannot comment on it. But the hospital supports the community in many different ways, both with in-kind charity work, where everyone at a director's level and above at the hospital, I've got 40+ directors, all serve either on a not-for-profit board of directors, committees, or volunteerism. We also put a percentage of sponsorships out to the community. We partner with the Tri-County Health Council to work on hitting the greatest needs for our community. So we do support both financially and with our time and presence. But as far as the tax base, I really can't comment on that till the process is done. Even when we were nationally owned, over 70% of the work done in the hospital was done by local vendors. We will continue that, especially now that our ownership is regional and local up in Reading. So that's something that we've always been very sensitive to, using local relationships with the vendors and the procurement of the work that needs to be done that we cannot do in-house. That will continue. Thank you for the opportunity, and thank you for having the interest in Pottstown. There's a lot of great things going. I hope you hear more about that today. Have a great day.